What do lymph node molecular markers mean for colon cancer? Imagine your doctor has just removed some lymph nodes during surgery for colon cancer. Traditionally, they look at these under a microscope to see if cancer has spread. But sometimes, tiny cancer cells hide, and standard tests might miss them. That's where molecular markers come into play, offering a more detailed picture of what's happening inside those lymph nodes. Lymph nodes are small, bean-shaped structures that are part of your immune system. When colon cancer spreads, it often travels first to these nodes. The presence of cancer cells in lymph nodes helps determine the stage of the disease, which guides treatment decisions and helps predict outcomes. Usually, pathologists examine the lymph nodes under a microscope to find cancer. But this method can sometimes miss small groups of cancer cells, especially if they are few in number. Molecular markers are specific molecules like genetic material or proteins that can signal the presence of cancer cells at a molecular level. For example, scientists have studied a marker called guanylyl cyclase C, or GCC, which is a protein found in colon cancer cells. Detecting GCC mRNA, which is a type of genetic material, in lymph nodes can reveal cancer cells that standard microscopic exams might overlook. This means molecular testing can find tiny amounts of cancer that traditional methods might miss, improving the accuracy of staging. Why does this matter? Because detecting these molecular markers can tell us if cancer has spread even when the lymph nodes look clear under the microscope. This information can help doctors better predict the risk of cancer coming back. If molecular markers are found in lymph nodes, it suggests there might be hidden cancer cells, which could mean a higher chance of recurrence. Conversely, if no markers are detected, it might indicate a lower risk, helping to avoid unnecessary treatments. This molecular information is especially useful for patients with stage Roman II colon cancer, where lymph nodes appear negative with standard tests. If molecular markers are present, doctors might recommend additional treatments like chemotherapy to reduce the chance of the cancer returning. If no markers are found, patients might be able to skip some treatments, sparing them potential side effects. It's important to note that molecular testing is still evolving. Not all hospitals routinely perform these tests, and ongoing research is comparing different markers to find the most reliable ones. These tests do not replace traditional pathology but add an extra layer of information to help make more personalized treatment plans. Other molecular markers, such as those related to tumor aggressiveness or genetic stability, also provide insights into how the cancer might behave. For example, markers linked to mismatch repair proteins and microsatellite instability can influence prognosis and treatment options, especially with newer therapies like immunotherapy. In summary, molecular markers in lymph nodes give doctors a more sensitive way to detect hidden cancer cells in colon cancer. They help refine staging, predict the risk of recurrence, and guide personalized treatment decisions. While promising, these tests are part of an ongoing effort to improve cancer care and are best used alongside traditional methods. Always discuss your specific case with your healthcare team to understand what testing options are right for you.